stroke. This is a brain damage. Is occurred when your blood vessel that have to supply to your brain is interrupted. And today we're talking about some type of the stroke. This is called hemorrhagic stroke. It can occur when your blood vessel in your brain is blocked, and blood is just gonna be bleeding surrounding your brain. And the next one is what are the causes of hemorrhagic stroke? There are the high blood pressures. And the next one is the brain aneurysm. And the last one is the brain injury. This is a causes that can cause your blood vessel ruptures, and there are risk factors that may be cause a hemorrhagic stroke. Okay, let's see what we have. This about the elder age, hypolipidemias, or having an avian abnormals, or excessive alcohol intake, or maybe you smoking a lot. This is the risk factors of hemorrhagic stroke. Alright, next one we can see the symptoms of this type of stroke.
The common presentation of stroke are headache, aphasia, hemiparesis, and facial palsy. The presentation of stroke is usually acute and progressing. Acute onset may have headache, vomiting, neck stiffness, increased blood pressure, and rapidly developing neurological signs are the common clinical manifestations of hemorrhagic stroke. Those symptoms can lead to the extent and location of hemorrhage.
So, if you know any symptom about hemorrhagic stroke, act be fast. The first test is performed to rule out the possibility of stroke in emergency room, and this is how it should be performed. Be balanced. Ask the person to walk. Do they have trouble keeping their balance or walking normally? Eye. Ask the person about their eyesight. Have they lost vision or experienced vision changes in one or both eyes? Face. Ask the person to smile does one side of the face do. Arm. Ask the person to raise both arms. Does one arm give downward? Speech. Ask the person to speak a simple phrase. Is the speech slur or strain? Time. If you see any of these signs, it's time to call 1669.
The next step to perform a vital and systemic examination. In patients with hemorrhagic stroke, there is a higher possibility of hypertensive crisis or abnormally high blood pressure. When you check the pupillary response of patients, it usually will be loss of the papillary reflex or pupil constriction when the light is shown on the eye.
Next is physical examination. The first is an X-ray CT scan is to identify the location of intracerebral hemorrhage or the area of brain damage. The scan enables the doctor to make differential diagnosis to determine the cause of the brain hemorrhage. The second is an MRI scan by a magnetic resonance imaging machine detects abnormalities of the cerebral blood vessels. The test will identify the location, extent, and cause of brain damage. The third is electroencephalography or EEG. It assesses the function of nerve cells in people experiencing thundercraft, severe headache, and dizziness but no known cause or epilepsy diagnosis. The fourth is complete blood count or CBC. It measures the number of red blood cells, white blood cells, and platelets. If there is bleeding in the brain, the test results show a high platelet count and a low red blood cell count. The last one is aneurysm examination and examination for arteriovenous malformation or LVM. Because The bulging aneurysm can put pressure on the nerves or brain tissue. It may also burst or rupture, spilling blood into the surrounding tissue. And arteriovenous malformation occurs when there is an abnormal connection between arteries and veins in the brain. This abnormal connection disrupts blood flow and oxygen circulation. The lack of oxygen can lead to bleeding in the brain.
How to treat patient with hemorrhagic stroke. Assess the severity of hemorrhagic stroke. The evaluation can be divided as follows. 1. Motor function assessment. 2. Sensory assessment. 3. Coordination. 4. Range of motion. 5. Muscle tone. 6. Cognitive and perception assessment. 7. Bowel and bladder function. 8. Pain. 9. State of mind. 10. Family, social and environmental condition. 11. Complication of congenital disease that affect the patient's rehabilitation treatment. Organize an initial rehabilitation program based on the patient assessment. This will give an example of a patient basic rehabilitation program as follows. 1. Provide knowledge about hemorrhagic stroke, precaution and first aid. 2. Train to perform physical therapy by arranging appropriate sleeping position, joint management to prevent joint from sticking together, chest physical therapy training to breathe correctly, practice eating and swallowing food and drink correctly, and practice using hands, arms, and legs in order to be able to use daily life with ease. 3. Eat useful drinks and help restore the body better. 4. Avoid situations that are at risk of disease. 5. Have a health check according to the doctor appointment.